continuing coverage of the World Healthcare Congress here in Washington, D.C. We've had some fantastic interviews, and also I want to thank those of you who are joining us online. In our studio right now is Olivia Ross, Associate Director, Employer Centers of Excellence Network, PBGH. Olivia, thank you so much for being here. Well, first of all, that is quite a mouthful. Yeah. So tell me more about PBGH first.
Yeah, so PBGH is the Pacific Business Group on Health. So you may have met other folks here who are from various business coalitions around the country. Yes. Pacific Business Group on Health has been working with purchasers and particularly large self-insured employers for over 25 years. And we did start as a regional coalition, but then have grown, and most of our membership now has national or even international presence. Okay. And we represent about 60 organizations altogether, which cover 10 million lives. So we have a really strong footprint.
Definitely. And in terms of your work with employers and providers and the partnerships between the two, what's new on that front?
Yeah, so my particular work is exactly that, trying to bring the provider, the employer voice to the providers to design something that's meant for them. So the Employer Centers of Excellence Network takes a model that has existed for quite some time. So for example, Lowe's in 2010 made a big move by doing a direct contract with Cleveland Clinic for cardiac care. We really see that sort of as version 1.0. And then another strong performer, Walmart, went out and did additional contracts, multiple centers for cardiac care, for example. So both of those players, as well as a number of our members, realized they wanted to have a similar voice and they wanted to impact the providers and get involved, but it was a much bigger lift than they could take on themselves. So instead we created a multi-employer collaborative where we can use those same kinds of initiatives, so a direct contract, for example, and yet have multiple employers participating. So they're piggybacking on the work of folks like Lowe's and Walmart.
And so are you paying attention to certain types of conditions and what kind of work goes into that?
Yeah, so our network started with, we always are looking at high cost, high quality variation. That's the best opportunity. So like many others, we started with joint replacements. So that was sort of the easiest bundle. There was the most work in that space. And we were also running an orthopedic registry at PBGH. So I had some in-house expertise. But we quickly moved beyond joint replacements to spine procedures because there was such a huge opportunity there around avoiding unnecessary care. Then moving quickly, we expanded to bariatric surgery. And that's one of the places where, although the cost variation isn't as dramatic, the quality differentiation is. We knew that there were folks going to facilities with really poor quality and seeing those bad outcomes, infections, leaks. So we wanted to help employers identify centers that had stellar outcomes. And most recently, we're kind of going in a new direction, looking at oncology. It'll be a slightly different model, but that's the place now where we see high spend and again, high quality variation.
Okay. And what providers, how do you choose your providers?
Yeah, that's a great question. We really feel like one of the things that sets us apart from all the either vendors or the health plan centers of excellence is our rigor at which we select the centers. So we start with publicly available data. That's one of the things that many programs use, only publicly available data. That's just the very tip of the iceberg for us. And we don't use a composite metric because that can hide deficiencies. So if you're strong in one thing and low in another, a composite measure hides that. Instead, we go straight to our facilities and we ask them for data at both the center and specific surgeon level. So we're approving surgeons, and these are metrics that you can't get publicly. We're asking for. So things like infection rates, return to OR, condition-specific outcomes like a dural tear for a spine procedure or a gastric leak for a bariatrics. And this is an unusual thing for a Centers of Excellence program to do. Moreover, we actually go and meet on site with every center we work with to make sure that the information they're giving us, for example, in our request for proposals, is matched when we're there on the ground. So meeting frontline nurses, asking them questions, that's really part of our process.
Right. Wow. Now, and you've been presenting it on panels. What's a key takeaway you want people to have from that?
I think that the biggest takeaway is really that this collaborative action has so much value. So for example, we, in addition to having the employers work together, so benefit, for example, for a small employer to get the weight of Walmart's 1 million lives behind their negotiating power, so that's a huge incentive. And then they can learn from each other on more basic things like sharing summary plan design language, or how the benefits communicated by one employer. If that was successful, they can teach another employer. So huge benefit there. And then on the provider side, we also mandate collaboration, and that's critical to making sure, A, there's a consistent experience across our program, which is really important to employers. They want to know that no matter what center their employees go to, they're going to get that same quality care. So our facilities, we work together to set our criteria. So for example, BMI thresholds or the way we hand off back to a home provider is consistent no matter what hospital you're going to as a patient. And then we use that opportunity of collaborating together. So we do facilitated calls and an in-person meeting each year to look at the current medical evidence and decide if we need to adjust our program, what we need to do to provide the best care for those patients.
Okay. Thank you so much, Olivia, for your comments. We really appreciate you stopping by.
Thanks. Bye-bye.
And I'm Mabel Jong. Thank you for watching. Stay tuned. Much more to come.